Hello there. If you're a health worker listening right now, this is for you. You're out there, maybe in a busy city clinic, maybe somewhere more remote. You solve problems every single day. Now, there's something new coming into the picture. Artificial intelligence, AI, it's making big changes in global health. And it's really important that you understand how it can actually work for you in your community.
Absolutely. And that's really why we're doing this deep dive today. We're looking at the Geneva Learning Foundation's new AI4Health framework. Think of it like a guide, a straightforward guide made just for people like you working right there on the ground.
So it's about making sense of AI in your daily work.
Exactly. Cutting through the complexity. How does it fit with your local challenges, what your community needs? It's a way to get a handle on this powerful new thing.
You know, when people hear AI, sometimes they think, well, complicated machines, maybe even worry about their jobs, their human touch.
Right. And this framework really tries to change how we think about that. It says AI isn't about replacing you. It's about partnership. Yes. The big idea is seeing AI not just as, some cold technology, but more like a helpful coworker. Someone digital working alongside you, boosting the great work you're already doing.
A coworker. I like that framing. It feels different.
What's really key here is how much the framework values your knowledge, your wisdom. It talks about something called contextual intelligence, which basically means AI isn't useful just on its own.
Okay.
It needs to connect with your understanding of what's happening locally. For example, AI might spot unusual patterns in disease outbreaks, things humans might miss because there's so much data.
Right. Seeing connections across lots of cases.
Exactly.
Yeah.
But it's your local knowledge that helps figure out why. Maybe it connects to a big community gathering recently, or a change in food that's available, or how your people are farming. AI sees the pattern. You explain the why.
That makes sense. So it's not just a tool, it's more interactive.
Yeah.
You mentioned AI helping to see patterns. How does that actually work, simply?
Sure. So when we talk about AI seeing patterns, often it's using something called machine learning. Think of these AI systems as really fast pattern spotters. They look at lots of information, maybe patient health records, but kept anonymous, of course, or weather information, or even, say, medicine supply levels.
And they find links, things that stand out.
Yes, links and anomalies, things that are different, much faster than any person could. The framework helps you ask, okay, what information do we have right here, locally, that AI could help us understand better?
Okay, practical applications. What about those smart checks you mentioned? Improving plans. Could you give an example for maybe a health worker in a rural clinic?
Definitely. Let's say you're planning an immunization campaign in your area. The framework suggests using AI for smart checks.
Oh.
So as you plan where the vaccines need to go, the AI could quickly check your vaccine stock levels against, say, up-to-date population numbers for different villages, maybe even recent reports about local road access.
So it might flag a problem?
Exactly. And we might say, hold on, this village road looks difficult because of recent flooding, or this area seems to have grown. You might need more vaccine X there. It helps you spot potential issues before they happen.
That sounds incredibly useful. Really practical. And just briefly, for those listening who are part of the Certificate Peer Learning Program for AI in Global Health and Humanitarian Response.
Yes.
This deep dive fits right into that, right? Understanding how this framework empowers you.
That's right. It's a core part of figuring out how AI can support leaders like you. The main message of the AI4Health framework is always this. AI is that thoughtful coworker. It strengthens your skills. It doesn't replace them.
Strengthening skills, not replacing.
Yes. It's about building up local leadership, helping you handle the specific challenges your community faces. Your judgment, your experience, that stays central. AI should help you build skills, build evidence from your own work, making your local solutions even better.
So the invitation to you, listening, is to reflect a bit. Think about your work today or yesterday, a specific challenge you face. Maybe it's keeping track of records or making sure every child gets their shots or dealing with new health issues linked to climate changes. How could you imagine AI being a helpful coworker in that situation, using your understanding to make things better?
What's one problem where a smart AI partner, guided by your wisdom, could really make a difference?
Just something to think about. We hope this way of looking at AI through this framework feels, well, helpful and maybe even a bit inspiring for your work ahead.